Hi, my name is Kaylee Dahlquist, and this is my video on the discussion of ethics in nursing research. Today I'm looking at a study on unopposed estrogen therapy and the risks of invasive breast cancer associated with it. So in this study, they had women that were on estrogen therapy or a different type of hormonal therapy or a placebo therapy. And they looked to see over a long period of time if the estrogen therapy increased the risks of developing breast cancer. This study was approved by an institutional review board at the Brigham and Women's Hospital that it was conducted at. This study does not specify if informed consent was given for the risks associated with estrogen therapy. We do know that they got their consent to look at their medical records and to look at their next of kin's records if they died due to breast cancer. But it doesn't go into specifics of saying whether or not they got consent to have these therapies done to them. And a lot of other studies, they would specify this. This one, they didn't really specify it. So it leaves it up to our interpretation. We're not really sure. It doesn't specify if these patients were legally competent or not either. They all had hysterectomies done on them, and they were all taking some sort of a medication. So I would assume to have had the surgery done, they would have had to do some sort of consent for that. So somebody legally competent would have had to have been involved. So I feel like there's probably somebody legally involved for this study as well. But again, it's not really specified. We do know that some of their rights were protected. Their right to self-determination was protected because they could withdraw from the study at any time, and they could deny the researchers access to their records at any time. Their privacy was protected. There are no names or unique identifiers used, so we know that's all good. Their anonymity and confidentiality was also protected, as well as fair selection and treatment. However, the protection from discomfort and harm is where I start to really question the ethics of this study, because as I said, they don't specify that they explain to these patients or participants anything about the risks associated with estrogen therapy, anything about what they were looking into. They said that in their surveys, they were constantly asking them if they had gotten breast cancer, but they nowhere in their study or their methods or their results or anything say, yes, we informed these patients that they may be at a risk for developing breast cancer from being on estrogen therapy. That's where I start to get a little bit uncomfortable, because that could potentially cause harm to them. This therapy could potentially cause them to have breast cancer. And that's where we start to question the benefit to risk ratio. Yes, we need to figure out if estrogen therapy is causing cancer, but does it need to be done on these women? Has there been enough research done beforehand? And at this point, I feel like that would be up to the patient. Maybe they really needed that therapy. Maybe they were educated that, yes, I know that estrogen therapy might give me a risk for breast cancer, but I feel like I need the estrogen therapy more. I'm willing to risk it. But that would require us to be told that. We aren't told at any point, yes, they were educated, or no, they were not. That is when it starts to have me question if this was really worth it for these patients. So overall, it was a good study. They got a lot of good data out of it. It was conducted very well, except for the area of consent and information. So overall, good study, just we needed more information. Maybe they did inform them. Maybe they did get their consent. Maybe every single one of these patients thought that it was totally worth it. But the fact that they did not mention it, when most studies would mention that they informed their participants, is making me question it quite a lot. Thank you. Have a good day.